In this question, you have to identify the reason for the cause of osteoporosis, which is an age-related disease of the skeletal system. Now, option A, decreased level of estrogen. Osteoporosis is commonly associated with a decrease in estrogen levels, particularly in postmenopausal women, because estrogen helps maintain bone density by regulating bone remodeling. So, when estrogen levels drop, bone reabsorption increases, leading to weaker bones and an increased risk of fractures. Hence, it is the correct answer. Option B, accumulation of uric acid leading to inflammation of the joints. This is incorrect because this describes gout and not osteoporosis. Option C, immune disorder affecting neuromuscular junction leading to fatigue. It is also incorrect because this refers to myasthenia gravis, an autoimmune disorder that affect the neuromuscular junction leading to muscle weakness and fatigue, but not osteoporosis. Option D, high concentration of calcium and sodium. It is also incorrect because high levels of calcium and sodium do not directly cause osteoporosis.